welcome to another episode of Navigating Cancer. I'm Dr. Joey Bennett, and I'm joined today by Wendy Hall, who is our licensed clinical social worker at the Robert Boisneau Oncology Institute. Thank you for coming back for another show. The purpose of our show is to hopefully enlighten and educate the community about different types of cancers, support groups, and everything of this sort. So glad to have you back for another episode. Today, we're going to talk about skin cancer, which I think is something very important with us living in Florida the way that we do. Very important for people like Wendy, who are light-haired and fair-complected, because skin cancers tend to come from sun exposure. So we're going to spend the entire program today talking about skin cancer, what it is, how to prevent it, and if you do unfortunately get a skin cancer, your options as far as how to treat that cancer.
Right, and I'm really glad we're doing this because we have had patients in our facility that we're asking, could we do something more about skin cancer? Even though they're being treated for it, they really don't know very much at all.
Exactly, and a lot of people think that the only way to treat a skin cancer is by surgically removing it, and we'll get into some details about the other options about that. But first of all, we've actually got some slides that we're going to show you today, and the first one talks about what is skin cancer. Skin cancer is the most common form of cancer diagnosed in this country, and when you hear statistics being spit out about this many 100,000 cases of cancer in the United States, it does not even cover skin cancer. And the other thing about skin cancer is that it is largely a preventable cancer. Skin cancer is one of these things that comes from having too much sun exposure. So if you can control your sun exposure and not have sunburns, you'll lower your risk. Third, melanoma is really the one that we are most fearful of, and unfortunately we are seeing a tremendous rise in the number of cases of melanoma every single year. It kills over 12,000 Americans alone just from skin cancer. So we don't want you thinking that this is something that's not a risk to my life. It is a risk to your life, and yes, a lot of people have skin cancers, and sometimes people even joke about the fact that, you know, I had a skin cancer, but I don't really consider myself to be a survivor like someone with breast or lung cancer. But they're serious cancers, and they can be fatal.
It's almost like it's just cosmetic, and that's all there is. Yeah.
Right, and I mean, we want to get rid of that perception, because you need to understand they can be life-threatening. Certain people are at much more of a risk than others are, and when you look at the risk factors associated with skin cancer, the first one is something that you can't really control, and that's your complexion. Are you fair to light complexion? And do you have freckles? Blonde-haired, blue-eyed, light-complected, freckled people get sunburns much worse than those with maybe a Mediterranean color to their skin, or even those who are black aren't going to be as at high of a risk as those who are light-complected. The other part of that is a family history, and this kind of ties back into the first thing that we talked about. If you're light-complected, you probably genetically got that, and so that ties in. The biggest thing, though, is your chronic exposure to sun. And what we try to stress more than anything is the fact of sunburns as a child. A lot of times we're seeing people in their 50s, 60s, and 70s who have skin cancers, and they're saying, well, you know, I haven't been out in the sun much at all over the past 15 to 20 years. Why am I getting this sun cancer? Or I've started wearing sunscreen. I'm doing all the things that I need to do. The problem is that's too far behind them right now. The problem causing skin cancers are the sunburns as a child and as a teenager. And so when you see people getting lots of sunburns as children, and if you're 70 years old, Wendy, we didn't know when I was a child what a sunscreen was or what you should be doing.
Right.
And so you understand that we now know a lot of things that we didn't know. We didn't know to use the sunscreens. Now we do, and so we stress that, I think, to our children and to our grandchildren. The other thing to watch at when you're at risk is if you have a mole. You know your skin and you know your body better than anybody in the world, and so you need to be checking your body on a regular basis, letting your family practitioner check you out on a regular basis. And if you see a little mole or something like that change on you, then you go and get it checked out, because those can be the early signs of a cancer developing as well. We know what to do, and like I say, we used to think that smoking was healthy. We used to think that sun exposure was healthy. You know, getting out in the sun helps you make vitamin D. It helps you live better. The problem you've got is there is a warning label, and unfortunately it's on the sun, but it's 93 million miles away. We know not to stare into it, but we need to understand that we don't want to have too much exposure to the sun. That's really the biggest thing that we can do to limit our risk of having sunburns. And these are things that we've all picked up on over years and years of research, understanding where these things come from, why it's happening to us.
That's right, and so many of the patients that I've met at the office were farmers and worked outside and didn't even wear hats, you know, back then. And I remember one gym teacher that said she was outside every day, 5 days a week, in the sun, no suntan lotion or anything, and we just didn't do that, you know, back then.
Well, we didn't know any better. So there are things, though, that you can do to help lower your risk of developing skin cancer in your lifetime. Again, if you're 60, 70, 80 years old, you're basically have set yourself in stone based upon what you did as a child. But for your children and for your grandchildren and such, there are some basic, simple things you can do to help lower your risk and hopefully even prevent you from having a skin cancer. The first one is something we all know about now. It's wearing a sunscreen. Sunscreens are highly effective at lowering the amount of radiation that you're exposed to when you're out in the sun. And the different SPF factors that are there vary greatly. Anything over a 15 to a 30 really gives you excellent protection. But the things you need to realize is apply it in the house about 30 minutes before you go outside. Reapply it frequently. Going above an SPF of 30 is just wasting your money because it doesn't really give you that much more of a benefit. It's just really putting on the sunscreen. Second is wear protective clothing. Wearing a long sleeve shirt, wearing a hat, something that covers your ears, covers the back of your neck. Those are the areas that tend to get the most damage from the sun exposure, and that's an easy thing to do. Avoid the hottest part of the day if at all possible. And in Florida, that's basically from 10 until 4. If you can stay out of the sun between 10 and 4, spend your time outside in the mornings and the afternoons. One, you'll avoid the heat that we deal with here in Florida, but second, you're going to lower the time that you're out there in the worst part of the radiation exposure from the sun. Wear sunglasses. Even if you've got a brim on your hat, you tend to get reflection of sun back up at you off the surface of water and things like this. Sunglasses will help protect your eyes. We treat people every single year who have cancers of the eyelids, and it's one of the hardest things to treat, and it comes from that. Fifth, we've talked about it before, avoid sunburns at all costs. That is the biggest factor that comes in here. And realize that even on a cloudy day, you can get a sunburn. You walk outside and you think you're okay, radiation goes right through those clouds, so don't think that just because it's overcast you can get away from doing that. And these are really some pretty simple things that people can do to lower their risk. We live in Florida. We live here for a reason. We love being outdoors for the most part, but you just have to do it with a little bit of common sense.
That's right, and one of the things that was new to me is when you said get the sunscreen on 30 minutes before.
Yeah, apply it. Yeah, apply it ahead of time. We'll be right back and talk about the different types of skin cancer.